Hi, John. Thanks for coming in today.
Good morning.
What can I
Thank
do
you.
for you?
So I've been having this cough for quite a number of weeks. It's been troublesome.
Okay. Anything else?
No, just I've been coughing so much that the people at work think I'm contagious and they're a little worried and they thought maybe I should come in and get an x-ray or some medication or something.
Alrighty. Well, let's find out more. Can you tell me more about the cough?
So a couple of months ago I developed this cold and started coughing a bit then, and then we moved into this old house that we were renovating, and it was kind of dusty, and cough seemed to continue on despite the cold symptoms improving a bit. And then I thought it would get better once the dust settled, but it seemed to continue on.
Alrighty. And I recall that you actually have allergic rhinitis in the springtime.
Yes, I do get that in the spring.
But the cough has never been like this before.
Not really, no. Don't remember anything like this before.
Okay. Can you elaborate? When does the cough come? What seems to bring it on?
Well, it seems to, at night for sure. Like when I first lay down at night, I cough a bit. And then during the night, I wake up with this cough. And first thing in the morning, I seem to have to blow my nose quite a bit when I first wake up.
Alrighty. All right. I'm going to ask you a couple of questions just to clarify a few things. I don't think you've ever been diagnosed with any breathing troubles, ever, correct?
No, I haven't. Now I seem to be troubled a little bit in the daytime when I go up the stairs at work. There's 3 flights of stairs, and I used to be able to do that quite fine, and now I can barely make it, and I get coughing once I get going up the stairs as well.
Oh, that is new for you.
Yeah.
So
Yes, it is, yeah.
New nighttime cough, a little bit of new chest tightness with exercise, and this came on after a viral illness and probably some allergen or dust.
Yes, dust.
Allergens in your new place.
Yes,
Alrighty.
yes.
I think I have an idea of what's going on, but I need to ask you a couple more questions to be sure. Any heart trouble ever?
No.
Okay.
No, never had any
And
trouble.
I'm not recalling you have ever had any reflux or heartburn?
No, I don't get heartburn.
Okay. And you're otherwise completely well, I think.
Yes, yeah, I try and look after myself and stay well.
Okay. Anything in the family like asthma, allergy, or eczema?
No, I do remember my mother and my sister used to use a puffer once in a while, but I don't recall anybody with any of the things you mentioned.
Okay, that sounds fairly typical. And remind me, do you smoke?
I don't. No, I've never smoked.
Never smoked? Oh, okay. Very good. Do you have any thoughts on what's going on?
No, I say people at work thought I had some terrible illness that I might pass on to them, but it just seems to be really troublesome and not really going away, which is unusual for me.
Okay. Well, number one, I'm pretty sure you're not contagious, so you can rest comfortably with that. What I think is happening is you've got some mild asthma. This is reasonable given your tendency to allergies and allergic rhinitis and your family history. And I'm going to recommend 4 things. That's a lot, but it sounds like you want to get your life back in order. All right. It sounds like we should come up with this plan. So number 1, I recommend you take a dry powder, inhaled medicine to rescue you from the shortness of breath or the cough that you get. Secondly, a dry powder that you would take every day to prevent your airways from getting littler and stopping any mucus production. Thirdly, for that runny nose that you get when you just lie down or you just get up, and it'll help for the seasonal allergies in the springtime, some nose spray. And fourthly, there's a lot of stuff we're talking about here. I'm going to recommend you see our asthma educator who will test your breathing and help you understand a little bit more about why we're recommending this. Does that sound reasonable?
Yes, that sounds very good.
Okay. So the follow-up plan would be to take the medicine, see the asthma educator, and I'd like to see you back in about a month to see how you're responding. The things that would make me want to see you sooner would be if your symptoms got worse rather than better, you started coughing up blood, or you had fever or chills or something that would make me think that your diagnosis had changed. You don't need an x-ray and you can confidently go back to work.
Great, they'll be happy at work.
They will indeed.
And I'll be happy to get the control of the cough. Thank you.
Excellent. Thanks
Appreciate
for coming
it.
in today.
Thank you very much.